Well, hello, I just wanted to make a video and I wanted to make an update on what is going on and where I am in my journey of vestibular disorder and share a little bit of that information with you. So last time I had made an update, I had kind of advised that I've been trying a lot of medication here and there, and actually I was in the process of tapering off the nortriptyline and kind of calling it quits. And around that third week, almost third week and a half, I started feeling a little bit better. I went from a 25 milligrams to 10, and I kind of saw a lot of the side effects go away. And I saw a little bit of my brain fog kind of lifted, and I was very surprised by it. And so I have remained on nortriptyline, however you say it. And right now I am in the 5th week of it, and I am on 10 milligrams. I tried to toggle back and forth between 20 and 10, and I feel like the best for me is 10. 20 might be a little bit too powerful for me and the side effects come back. So I am still at 10. Eventually I want to try 20 because I feel like potentially it will lift some of my brain fog more up. It is a preventative for the migraines. I have also seen a reduction in my migraines, especially on just like the daily stress headaches, the ones that have the pressure on your forehead and into your eye area. Another thing I've found is the constant pressure around my sinuses and eye area has been lifted. Not completely. I get some of that still here and there, but I have seen just like an improvement of it. So I am not yet ready to call it quits with it. I am going to continue and see where I land. This is besides the Lyrica, which I really like because it gives me that lift as well. But besides the Lyrica, this has been the only one that my body really can work with it. And I almost gave up a little bit too early. So now I'm going back and seeing, well, maybe did I give up too early on the other ones? And so, obviously I'm going to stick it up with this one and see where it lands. Now, I still get the breakthrough my vestibular migraines. I still get the uptick in dizziness. And for those, I am taking naratriptan, and that is a wonderful drug. That, for me, works wonders, and I have no side effects with it. I will pop one in when I feel it coming. I would say it does make me a little lethargic. Not completely fatigued. I'm already fatigued anyway. But it does make me a little lethargic, and I may have to go into bed and just like let it pass for a little bit. But I can't really tell if it's the pill or if it's the attack coming on, because with the attacks, I actually get really fatigued as well. I haven't taken one just when I'm feeling great because I don't need it. So, it could be it could not be it. Other than that, I honestly haven't seen any side effects on it. It completely lifts away my pain, one, and then two, it does decrease the intensity of the dizziness. It doesn't completely take the dizziness away, but it does diminish it by a lot. So with those breakthrough, I'm taking that as well. I'm still on the Lyrica, so that is still there. I'm on 75 milligrams. I was at 50, then I increased that to 75. I was doing at the very beginning 75 twice a day, but because I am on a lot of drugs, I went to just once a day, and it's working for me quite well. So it really is just a juggle of finding the right medication cocktail. Now, I have talked about, depression and anxiety coinciding with vestibular disorders. Very normal to have that. Um, Nortriptyline is a antidepressant, so I did see an increase in the depression and the brain fog at the very beginning. And in fact, I could see it in the videos that I've been shooting because, yes, you can tell I was probably speaking really slow. And that's the brain fog coming through. So with the nortriptyline after that third week mark, I did see the brain fog lifting. I did also see an improvement of the depression. I feel like it really increased the brain fog and the depression at the very first 2 weeks. And then that third week, it kind of lifted it. And I feel a lot better in terms of that. I feel like my anxiety is under control. I feel like the depression's under control. Mind you, you're always going to feel a little sad and those mood swings will come in, but they're a little bit less and less for me. Now, I have taken into consideration that sometimes I will have some of that breakthrough anxiety, especially anxiety. And at the very, very beginning, I was giving a Prozalam, and that's just the generic for Xanax. At the very beginning, they gave me that because, I was an anxiety mess. And, with all the vestibular issues, that's usually what they give you. It's either Valium or something to help you with that. And I didn't take it because, again, I think there's this stigma of having to take it, especially as a person with no history of anxiety or depression. I was just kind of on a mental block, and I had the prescription there, and I didn't take it. And I had talked a little bit about the anxiety that goes along with the medication, and I'm telling you, that's so real. And I don't know if it's just the anxiety or if it's the vestibular thing, but I've talked to people and they say, I just can't take drugs. And it's real. Like, I'm the one that will get a new drug and I will read and reread and triple read all these side effects. And I'm like, why would I take this? Why would I take this? And, getting over that hump is really, really hard. But I cut it in like a fourth, and obviously a fourth's not gonna help you. But I took it and it worked. I was like, oh, and I have no side effects with it either. Obviously, you have to be very careful with it. It can be an addictive drug. So I do have a limited prescription for it, and I only use it when the breakthrough anxiety attacks come through. Now they're not very often. I have to tell you that I kind of can manage the anxiety through, well, the other types of medication, obviously, and also with some of the techniques that I've been both implementing and learned from vestibular rehab and also from just mental therapy, mental health, and just understanding anxiety, making sure I manage that, and that has been great. Another thing that I had a prescription for, and actually at the very beginning I tried it because they would tell me that it's probably some neck issues. I've had chronic neck pain for a while, and I've used Flexeril on and off for about 10 years. And at the very beginning, I took it and it made my vestibular system just worse. I didn't understand why I couldn't take it. And then I don't know if my body shifted and it just changed, or if because now I have better medication management and I'm able to maybe my body can actually take it a little bit better. I'm not quite sure, but I started taking cyclobenzaprine, which is Flexeril, and I take 5 milligrams, a very, very low dose, a day at night, and one, it helps me just sleep through the night. I had bought a smartwatch, and one of the things that I noticed at the very beginning was I wasn't able to get like that deep sleep. And as you know, when you go into deep sleep, that's when all the body restoration happens. So that's when your cells starts to, regenerate, and healing begins to happen. And I was surprised, and actually my cardiologist was the one who suggested to get a smartwatch because I was looking at my palpitations, heart palpitations, and he suggested I kind of just see, on average, my day-to-day heart palpitations and heart monitor there. But I've used it for my sleep as well, and one of the things I did find is I wasn't getting that deep sleep, and I could try other types of medication, and it just didn't work very well. I tried melatonin, didn't work for me. I've tried CBD as well. It doesn't help. It helps relax me, but it doesn't help with that sleep. And ever since I started with cyclobenzaprine, it works. And on that, it actually helps my neck. I've been having, and I've been telling you, a lot of neck pain. Very normal with vestibular disorders. Tightness, SCM muscle, very, very tight around here, behind the ear, it connects here, pulling and pulling and pulling. Trapezius, upper trapezius, very, very tight, pulling the base of my head backwards, so tight, feels like I'm having a helmet on, have these, clam type muscles around, tightness, 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 so obviously pulling, oof, so much pain, so much pain. That was contributing to a lot of my migraines and headaches. I have incorporated the Flexeril every night. Takes care of it. I don't wake up with just the stiffness of my neck. And it also has helped me with my back. I know I have kind of gone through my journey of lower back pain. Added bonus, I have also seen a decrease of my joint pain when I'm taking it. So, I am on a lot of medication. I am definitely feeling that I take a lot of medication, but it is working. It is working. It's working. I also am taking Timidol eye drops for any breakthrough head pain. Usually, I try to do it at night, and I'll put my drops in my eyes, and it does aid with having those breakthrough headaches. So, Timidol eye drops, Alprazolam when needed, Flexeril when needed, nortriptyline as a preventative, Lyrica as a preventative. Whoa, a lot, right? And also supplements. I am on a lot of supplements, and I'll go over some of the supplements here. Excuse me, at a later video. I'm still not 100% on my supplements. I'm still trial and error. But I'll share some that I really, really like here soon. Wow, where am I? Well, I also have gone through a lot of testing and also visited some different doctors. Neck pain, I went to a well, it's like a doctor of physical therapy, but it's not it's a physicist. I don't know. I'll probably put it on the link below. But went to him to try to figure out what my neck pain issues were all about. Muscle, nerve pain coming through. I'm going to get some trigger point injections on some of those areas. Hopefully that will help in loosening some of those muscle aches and pains that are coming through. Also, one of the things that I did have the luxury of going to is a long COVID clinic, and wow, I was very, very impressed. Highly, highly would recommend. I know online I had seen horror stories about, waste of time, them not really doing anything, and then realizing that this one was amazing. I had the best doctor, very, very, very skilled, and she listened to everything that I had to say. Now, with long COVID, there is just another layer of issues that I have to deal with, and I will make a video out of that too, because long COVID and marrying the vestibular disorder, whoa, my body is just going through a lot. So I will be posting a video on that as well. So I am kind of in the middle of all of that. I did have a second VGN testing. My neurologist wanted me to just verify some of the findings. I had to go to another city that had just a better, just had the equipment to test a little bit better, and was able to reduce some of that. They did find some abnormal findings again, so it comes from my ear. I will be having my ENT appointment with that specific clinic and that doctor here shortly, but I had to get that testing redone. Very similar to the first one. However, good news is some of the percentages got actually better. So I am very, very glad to have seen that. But there's still some abnormalities there. So even 6+ months later, it can be a little bit discouraging in one way or another, because you're still seeing that abnormality still there. Well, it is what it is. So I will be kind of going and transferring that treatment over to that clinic. Nothing really bad really with the local clinic here. It's just that they don't have the technology, the capability, or the equipment to do some of that testing that the other clinic has. And so it just makes it a little bit more rounded of a treatment plan. So I will be transferring there. It is about 2 hours away from me, so a little bit more travel, but I think it's worth it, so I'll stick it out. So yeah, this is where I'm at. I am kind of happy where I'm at yet. So what is next? Well, I do have Botox as an option on the table. And in fact, my neurologist is really, really pushing for that. One of the reasons is because I have daily headaches, and really up to this point, no medication has really taken every single one out, and I'm still dealing with them. And so he has really, really stated and recommended that Botox would take care of the majority of them, and we would have only a breakthrough pill, that like a neurotriptan, that I could use for those breakthrough ones, or completely off pills. I don't know yet. So give me some of your opinions, give me some of your experiences if you've done Botox for migraines, if you've done Botox for vestibular migraines, what has been your experience? What was the outcome of that treatment? I'm not really against it, but again, going back to the anxiety of around medication, I've done my research. There are some side effects that come through it. There could be some things that are irreversible, and so I still am a little hesitant in doing that. I'm waiting on my trigger point injections on my muscles to see how far that will take me and if in fact it works, and so I'll make a decision there now. So this is where I'm at, almost on month 7 of vestibular disorder journey. I'm kind of using the vestibular disorder journey because I have so many diagnoses, and also potentially when it started or how it started is still a little bit of a question mark. Don't know if COVID, was the sole contributor to it. We'll never know. But vestibular something definitely is something that I'm still struggling with. Where am I at with my symptoms? I think I shared that I am dizzy, and there's still a level of dizziness every day. There are hours that I'm not dizzy. So, for example, this morning I woke up a little bit dizzy, a little bit disoriented. I had breakfast, had my medication, my supplements, went about my day, and then I would say from an 11 a.m. mark to about a 2 p.m. I wasn't dizzy at all. Now, it's a little bit different because I may have postural dizziness or just visual dizziness. So, for example, today is Sunday, and I went to church, and they had some lighting, and the lighting was colored lighting. So I kind of was seeing the specific lights to my left eye. It was bothering me, and I started seeing a little bit blurry out of that, and so I was like, oh. And once the blurry vision starts, then I felt like that drop feeling. Like the only thing I can describe it is like maybe in an elevator, you're going down the elevator and it stops, but then it like drops more, and that's the feeling that I got. So, but other than that, I felt pretty good. I didn't have anything. And then around the 2 o'clock time hour, I started feeling the bobblehead coming through. Once the bobblehead feeling starts, my neck starts getting tight, start feeling my ear pain, and then I was like, well, I'm gonna do my lunch, a little bit of a late lunch because it's Sunday, so I woke up a little bit later anyway. Take my Lyrica, take some of my other supplements, and feeling great. Feeling great. So that's what I mean. It comes and goes. Some hours, not good. I'm going to be having migraines. I'm going to be having really bad dizziness. Some hours, not bad at all. So this is where I am at a 7-month mark. Honestly, I kind of feel like if this is it, I can kind of manage through it. I can live with it. Obviously, I know that there's going to be more of a recovery coming through, hopefully in the months ahead. But 7 months in, I think once I got my medication cocktail in, I'm feeling a little bit better, kind of hour by hour. So, if you have anything that you want to share with me, please do so. Any tips, any tricks? What's your medication cocktail look like? What does your supplement cocktail look like? What are you doing to, have some of that decreased dizziness? But share it with me, and I hope that your journey is taking you on really just a journey of health and wellness, and I hope God can give you all the blessings. See you later.